Raise your hand if anybody in your family has dementia. All right, about 50%, cool. And raise your hand if you've been able to reverse dementia in 1 week.
Not one.
Really? Fantastic. All right, so just a disclosure, I'm basically a co-founder of Clinical Peptide Society and also MD Lifespan. So dementia, or basically, it's scary because there's 55 million Americans, well, actually, yeah, 55 million people affected with dementia, and in 25 years, it'll double, which is like, before you know it, 25 years will be like right around the corner, but over 100 million people worldwide will have dementia. And currently, there is no FDA-approved medication that will reverse it. They're trying so hard, they're spending billions of dollars looking for that silver bullet, but I don't think they'll ever get it. So this is really important because in any disease, you just have to kind of look at all the different ways that disease form. But neuroinflammation, whether it's in the brain or other part of the body, neuroinflammation is key. If you can reduce that, that will really help. And mitochondrial dysfunction, you can PubMed any condition like Parkinson's or Alzheimer's, you'll find mitochondrial dysfunction. And then there's excessive oxidative stress, so you're kind of rusting quickly. You have loss of apoptosis to get rid of the bad cells, accumulation of these zombie cells called senescent cells, and environmental toxins, which is the hidden driver of many conditions. And I'll tell you how to reduce environmental toxins and depletion of stem cells. So here's a little video. If you can click on this, this is a woman who's 83 years old, and she came to see me from São Paulo, Brazil, because her son, I'm from Orlando, and she's very unstable. Well, anyway, she's speaking in Portuguese, she's upset, she's irritable, and her son, who actually is my patient, said, can you see my mother from Brazil? She sees the top doctors, the top neurologists, the top gerontologists, and she's doing terrible. She's on so many different medicines, and she's just going downhill. And I go, sure, I'll be glad to see your mom. And I said, how long do I have? He goes, 1 week. And she's not coming back. I go, okay, that's better than 24 hours, because sometimes people come to my office and they give me 24 hours and I have to do my magic. So she came to my office. She was on several of these medicines, and I did some blood work. I knew by the time she would leave, I wouldn't get it, but I just wanted to document she had low estradiol, low progesterone, low vitamin D, and that's what I suspected. So I put those three on her estradiol patch. We had a great lecture yesterday on how estradiol can help the brain. Also put her on progesterone, because progesterone, there's receptors in the brain that can help with cognition. Vitamin D can increase BDNF, brain-derived neurotrophic factor. And then I gave her a peptide called Cerebrolysin, and I'll be talking about that. And she came in every day for IV Cerebrolysin. And every day, the family noticed that she was getting better. By the time she left, totally different person. So her son would buy 3 months of Cerebrolysin, estradiol patch, the micronized progesterone, vitamin D, and go down to Brazil to give it to her mother. And she, instead of getting IVs, she got IM injections 7 days a week. And she did fantastic. So you remember she was using a walker and a cane. Now she wants her grandkids. She's interactive. She remembers everything she was eating. So anyway, the family thanks me because we got her mother back. So anyway, so next slide. So we're going to be just talking about Cerebrolysin. I could talk about many different neurotropic agents, but Cerebrolysin is an amazing peptide. It's classified, actually, technically it's not really a peptide, but anyway, everyone says a peptide. It was discovered in 1949 in Austria. It comes from a young pig's brain. And basically, they've noticed that if you put this substance in a petri dish, it can grow new neurons, which is amazing. So there's been studied, and there's 50 countries around the world that use for dementia and for stroke, and even for children who basically are born with hypoxic damage, so they have problems with speech. So they've even used it in kids, which has been shown it's been safe. And I just saw a woman, one of my patients, she I see husband and wife for over 17 years. And so Klaus goes, can you see my mother? She lives in Germany, and she's forgetting everything. And I go, sure. And I go, how long do I have? Oh, she's going to move with us forever. I go, okay, I'll be glad, but how do you know if I reverse the dementia, she doesn't want to go back to Germany? And Klaus goes, Dr. Lee, we built a house, a new house right next to us in Satellite Beach, Florida. She's staying. 2 months later, she goes, I can't stay, I'm going back to Germany. Because her brain got better. So instead of 1 week, I had 2 months with her. So the funny thing was I gave her Cerebrolysin. I said, you're coming from Germany. You can get it from Germany, but anyway, I can get it in the US. So Cerebrolysin contains these growth factors. There's a glial cell line derived neurotrophic factor, there's nerve growth factor, ciliary neurotrophic factor, which can help the brain grow. And what's the data? There's 5 quick studies I'm going to go over Cerebrolysin. So there was a large meta-analysis of 6 randomized double-blind study-controlled studies. They're using 30 mLs per day of Cerebrolysin. It doesn't come in milligrams. It comes in 10 ml vials. So if you just put these 3 vials in 250 cc's of normal saline and infuse it. So all these patients had 20 IVs Monday through Friday for a month, and they infused 30 mLs of Cerebrolysin during the first month. So the results, by the way, median age was 72, and Cerebrolysin was much more effective compared to placebo at 4 weeks, and that's also at 6 months in regarding cognitive function. So here's a second study. What about with the use of Aricept? So they did in 2016, a randomized double-blind trial showing that Cerebrolysin increases BDNF, and also the combination of both increases brain-derived neurotrophic factor. You cannot take BDNF. You have to create it in your brain. So vitamin D can help that. Also Cerebrolysin, and there's other peptides that can help increase BDNF. What about if you have the ApoE4? Now, if you have the double hit E4, you're a higher risk for heart disease and dementia. They did a study with that, and it shows that taking Cerebrolysin also increases BDNF for patients with the double hit of the ApoE4. Here's another study with first-degree relatives. So, people raised their hand if they knew someone with dementia. So, actually, this study was really interesting because they used a little less, 20 mLs per day, 1 month. They gave like Monday through Friday IV. And in those patients with basically a risk factor, a family risk factor of developing cognitive decline, improved cognition. So this is the 5th study showing what about with vascular dementia. This Cerebrolysin showed that it improved also with vascular dementia. So Cerebrolysin is an amazing, let's say, peptide to basically help. And I've actually tried it. And my experience doing intravenously was that it felt like the hamster running basically in my brain was going faster. I didn't get the jitters, but everything was like performing much faster. So instead of doing IVs all the time, I just do IM. So I just basically try to get an IM shot twice a week, just 1 ml rather than 10 mLs. We just transfer it into a multi-use vial and just draw it up and just inject. So I want to talk about 2 more cases of reversing dementia. This is totally different. This case study has nothing to do with Cerebrolysin. So here's a guy who sees me. He moves from Colorado to Florida, and he's done very well financially. And he sees me in April of 2022, And he has hypothyroidism, prediabetes, hyperlipidemia, he's hypertensive, overactive bladder, sleep apnea, and narcolepsy. And on his first visit, I remember he was just sitting right next to me, and I'm pretty good in trying to finish people's sentences if they're stuck, but I had no idea where he was going. He just started and just stopped cold turkey. And it was, he felt it was an awkward moment right there. So he had one of those moments where he just had like basically a total blank. And so we did a little mini mental exam, and he could not recall 3 things in 5 minutes, which is 1 out of 3. So this is a list of his medications. And anyway, he said he could not take statins because it hurt his brains. So everyone that comes into my office, I do an extensive testing. So I do biological age, it's an epigenetic testing, and he's actually, intrinsic age was younger than his chronological age. He was 75.9, his chronological age was 79. And he's pace of aging, you want to be under 1, he's just at 1. So anyway, his rate of aging is a little too fast. And we do this computer test to see his cognitive function. So it's called the CNS vital sign. And we used to have the laptop in my office, but then so many people just used it so hard that it damaged the keyboard. So I said, forget it. We'll just instead buy another one. We'll just give you the link and you do it at your own house. So you can see that he scored in the red and the orange, which is not good. He had only 2 in the green. And you'll see over time, his CNS vital sign got better. So, which is kind of a objective way to see how his brain is doing. So if you saw my results when I first did it, you wouldn't come to see me as a doctor, because it's like, look, oh my God, you're not that smart. So anyway, but if you practice it, you'll get better. So this is kind of the protocol, what I did since April 2022. I started him on a peptide called Cmax. Cmax was developed in Russia, and it actually is a derivative of ACTH, and it can increase BDNF. They actually treat patients with stroke and also with dementia with Cmax. It's a nasal spray. And I eventually got therapeutic plasma exchange, and I'm going to explain that a little more in detail. So he was my first guinea pig, and anyway, he had to go to the bathroom halfway, and if you have to go to the bathroom, you have to stop the whole thing. So he got a half exchange, and then we did umbilical cord tissue, mesenchymal stem cells with exosomes, and then later we gave epithalin. And then you can see I also gave the mesenchymal stem cells exosomes with epithalin, and then later several more TPE. And what's amazing is by the time he got to his 3rd, he told me, Dr. Lee, the light bulb went off in my brain and I feel fantastic. It's like, he was a professional trader, and he goes, the last like 8 years, I just didn't feel comfortable in making trades because I couldn't trust my memory. So he goes, and you're too expensive, so I have to make more money to afford you. So anyway, and then I basically, so this is the whole protocol I gave to him. And so you're probably asking, why are you doing therapeutic plasma exchange? It's because we live in a toxic world. There are over 144,000 environmental toxins that are man-made, and we only can test a little fraction, less than 1% of it. So this is me. And by the way, all my new patients, besides getting a biological age, I do a test to look at their environmental toxin load. So there's a company out there called Vibrant Health, and you can do the Toxic Burden Plus. So it looks at basically if you have Roundup, you have atrazine, which is a herbicide. It looks at BPA, parabens. It looks at heavy metals, mycotoxins. It looks at the basically forever chemicals called PUFAs, PUFAs. So it looks at many other different things. So some of my patients, they have 10 in the red, which is over 90%. Some people have 20. I have some people over 30 environmental toxins in them. So the best way to remove environmental toxins is this machine, basically a plasmapheresis machine. And this is used by every American Red Cross center in the US and is in all the hospitals. So this is not an easy device to use in your office, but I did a training in critical care fellowship and also in diabetes, well, endocrinology and diabetes and metabolism at University of Pittsburgh. So I was kind of the weird guy that I love critical care. I love to do procedures, but I also like the esoteric part of endocrinology. So I did 2 fellowships. So I'm comfortable in doing triple lines, central lines, and doing procedures with my hand. So the thing is that when you do this procedure, you get 2 IVs. And one of the IV is a 17-gauge steel catheter that you have to put in for the inlet. The other one's a 21-gauge plastic. So you have to be really good with ultrasound to basically put that in there. And I tried a whole year to try to figure out, can I use a different device? I used all these different angiocaths, triple lines. I just could not figure out I did IJs in the office and all that. So, I mean, if you're done critical care, this is easy peasy. So I've done it. I've done thousands of central lines. So the thing is that I had guinea pigs and they would come in. And the problem is, if it's not steel, this machine basically has high pressure, will basically have occlusion. So I just couldn't get the flow rate right. So after 1 year of just experimenting, the conclusion was I'm going to use the 17-gauge 1-inch needle there. So anyway, we tried so many different catheters. I also had an intensivist come in and we were experimenting with different things. So you get 2 IVs. It comes through a machine, cleans out your blood, and you get all your blood back. It takes about 90 minutes to get done, sometimes 2 hours depending on the flow rate. But on the side of the bag, side of the machine, we remove about 3 liters, 2.5 to 3 liters of your plasma. And we discard that because we put citrate. Citrate basically is a natural anticoagulant. So we remove your plasma, and your plasma there, if you check for it, they'll have microplastics, they'll have your PUFAs, they'll have your Roundup, they'll have everything that you're trying to get rid of, your mycotoxins and heavy metals. So this is basically a study that came out in 2022 by Dr. Kiproff, and he shows that it actually reduces biological age. So you can see here, before TPE, you're in the orange, and then after TPE, your biological age drops. So you get younger. So who doesn't want to get younger? So it lowers inflammation. Remember, part of the brain, Alzheimer's, neuroinflammation. It lowers oxidation. So the oxidative stress, high oxidative stress, lowers senescence, fewer cancer markers, fewer Alzheimer's disease markers, improves the immune system. So, can serial TPE remove synthetic chemicals from humans? Just came out May of 2025 by Paul Savage. And this is part of his data. Herbicides come down. So here's atrazine, glyphosate, Roundup, one of the most popular chemicals used worldwide. That's poisoning our system. Here's microplastics. It comes down. Here's heavy metals. I mean, heavy metals, you can do chelation, not easy, but not many people can do it. I have heavy metals. I have mercury and lead. I am the worst patient. I know what to do, but I just could not basically do the chelation protocol. I do 5 of these, my heavy metals come down to 0. Here's my 2 sons, my wife, my mother. They all have done therapeutic plasma exchange. I've done about 10 of them already. The only one that hasn't done in my family is my dog, Sparky. I don't think he'll lay still. So what about the data with therapeutic plasma exchange and reversing dementia? There was a huge trial called the Ambar trial. The Ambar Study was a multi-center, randomized, double-blind, placebo-controlled study. It was a phase 2b/3 study. They had 347 patients with mild to moderate Alzheimer's treated for 14 months. And so there was a group with TPE with 5% albumin once a week. They did it every week for 6 weeks. And then they did low volume plasma exchange once a month for 12 months. So anyway, the treatment with the Ambar study showed that it worked, and the blue one is the one that, well, what happens if I just donate my plasma? Because that was the big question. Can I just donate your plasma? You can donate your plasma. It's only 250 cc's of plasma you can donate. Here we're removing 2.5 to 3 liters of your plasma. And once you remove your plasma, you have about 15 liters of plasma in your body. You cannot remove all 15. If you do, you're dead. So you remove about 2.5 to 3 liters, and in 24 hours, your body makes brand new plasma, free of toxins. That's why we recommend you do about 5 of these TPEs in 1 year, and then after that, once a year afterwards. But the thing is that if you just did with no replacement, with just no albumin replacement, because you're losing a lot of protein, when you remove plasma, it's basically, there's all these, you can remove spike proteins, you can remove albumin, and other proteins. So that's why we give back albumin as a replacement. And in this trial, they did albumin, but they also did something with IVIG. And so all of them really work, but if you did TPE with just like a plasma donation, it doesn't really work. So the bottom line is,
Question?
yes.
Isn't it completed plasmapheresis isn't completely dependent upon the type of filtration?
So the question is plasmapheresis dependent on filtration?
The type of filtration.
Type of filtration, yes. There is something called apheresis, which they use two basically filtration system, and then they give back your plasma. The problem is they remove some toxins, but there are microtoxins that go back in your system. I don't believe in apheresis. I believe in therapeutic plasma exchange, where you remove your plasma to get rid of all those toxins. Why give it back? That's the thing. My patients that they're getting like on testosterone and their hemoglobin goes up, they talk about, do you want to donate your blood, and plus, do you want the plasma come back? I said, don't give back the plasma, just throw that away, because it's the dirty stuff. Yes?
So I'm a little bit concerned about what's left in the bag. It's important that the body needs that we discard. So can you review for us what the adverse event profile, major and minor complication rate is in doing this procedure?
All right. It has been used, this has been used since the 70s, therapeutic plasma exchange for people with autoimmune issues, people with clotting issues, with the autoimmune issues and all that. So the thing is that, I can, Guillain-Barré and blah, blah, blah. So it's been overall, the data shows it's very safe, relatively safe. The issue is, the problem is that you could get hypotensive with it if you don't know how much calcium to give back. Calcium is usually just extracted, and that's the problem with the whole procedure. There is a formula in terms of trying to get the calcium right, because if you give if you're behind on calcium, they become very hypotensive, and they don't become tachycardia. Their heart rate doesn't rise. You have to put in Trendelenburg and push albumin and give calcium to basically get the blood pressure up. So when we first learned, it was trying to get that calcium right. So that is the major concern, is you can actually have issues with significant hypotension. And if you don't correct it right, they can code on you. So, but it's an elective procedure, and I've probably done over 300 in our office, and we haven't had an ill effect. Okay, one quick question I got to...
So just to his point, when they studied the serum markers after the exchange, what's the last data point? Was that 6 months out? Because again, you're going to get reequilibration when the
Yes, the last one was 6 months out. 6 months out, yes. So I use exosomes because everyone knows here about exosomes. I think they're the magic of basically of how stem cells actually work. And in animal models of Alzheimer's disease, they use exosomes, and it basically kind of helps everything work better. And then mesenchymal stem cells, this is derived from human umbilical cord, can actually help with everything in terms of getting the brain working better. But how do you put the mesenchymal stem cells in the brain? It doesn't cross the blood-brain barrier. You can use mannitol, you can use vibrating devices and all that. So you can use it intranasal to bypass there. So, and how do you convert stem cells into neurons? So here's an article. Basically, it comes from the pineal gland, a peptide called epithalin. And epithalin was discovered by Dr. Cavison, who unfortunately passed away just recently, but he basically discovered this. And the thing is that it's a 4 amino acid peptide. It is just universal, not only humans, but in the animal world too, because it comes from the pineal gland. We have that melatonin and epithalin secretion from the pineal gland. But here's his study. Using mesenchymal stem cells from human buccal, just from men, from the buccal cavity, they used epithalin, put it in a petri dish, it activates 4 different genes, and then you get neurons in a petri dish. Isn't that wow? Wow. It should be wow. Here's mesenchymal stem cells, make new brain cells. Well, why don't you use this combination? So my protocol, well, derived from Dr. Cavison, you use 5 milligrams sub-Q daily for 10 days in a row. And then we give the mesenchymal stem cell intranasal on day 7, around day 7, day 6, day 7, and then continue afterwards, hoping that it will convert into new neurons. What works in a petri dish may not work in vivo, but you have to get it from a 503A compound pharmacy. Lately, couldn't get it, but now you can get it. The last place you can get it is through a compound pharmacy called Grand Avenue Pharmacy in Texas. And epithalin has shown that it increases telomere length. In my patient, not only his biological age improves, we reduce his biological age, but also his telomere length increased in size. So in this patient, he started at biological age of 75, and it goes down to 68.3. TPE by itself does that. His telomere length increases. This is huge, 6.45 kilobase to 6.59. Show me what you do to increase telomere length. It's not easy. And reduce biological age. What? You have to meditate like crazy. So here's his baseline CNS test. This is first improvement. This is in December 2023. Here's the published paper. And then I tested in 2024, should test him again. But you can see he's now all relatively, average there. So since I'm from Korea, that's not good enough. I want him to be all green or higher. So he can't die until he gets better results. So my mother, third case, she has Alzheimer's disease, but she has breast cancer. Estrogen, progesterone receptor positive. I cannot give hormones to her. She was on hormones previously, and then once she stopped, her brain went down. I knew this was going to happen. So she didn't believe she had Alzheimer's. She didn't believe she had a memory issue. She basically had a big argument with my wife, and my mother stays with us for 3 months in Florida. She's from Pennsylvania. Every year, my wife would say, 26 years, every day. The next year, 27 years, 27 years. So the argument was, my mother goes, I didn't make egg rolls. And my wife pulled out the freezer. You made it last week, and another one. You made it a month ago. It was that evidence, the frozen egg rolls. And my mom goes, okay, I do have an issue with memory. I didn't give her cerebrolysin. I just gave her that. I gave her epithalin, also exosomes, and then the intranasal, basically mesenchymal stem cells, and one therapy. Fantastic. Helped her brain. So she came back last winter, so I did another therapy on her just as a maintenance. so she just got back from Korea. She actually was interviewed at the Korean government because my father obtained this rare book that documented the Korean government that when Japan occupied Korea, they had basically a provisional government in Shanghai. And it was all documented. And my dad had a copy. It's the only version, full version. It was sitting in my basement for years. I mean, I thank God I didn't rip it up, but anyway, it was, anyway, so my mother said, she was interviewed and all that. Memory is perfect. I was able to do the interview. So she knows that it has saved her life. So in conclusion, mild to moderate cognitive decline can be reversed. You should remove the bad stuff using therapeutic plasmas and give regenerative peptides like Cerebrolysin, Cmax. And remember, epithalin with umbilical cord tissue mesenchymal stem cells can generate new neurons. So thank you very much.